I was nominated to be part of the Infection Control Committee Council by Shelby. So I went to the first meeting this morning, or my first meeting. They've been meeting for a while. So I'm going to just go over briefly kind of what we talked about this morning so that you guys are abreast of kind of what's going on from that standpoint. Hand hygiene observations. Did you know? I did not. Every unit's supposed to do at least 30 hand hygiene observations per month. So I will talk with Shelby this month and try to figure out for October, November what we can be doing to be compliant with that. Next, we talk about it's flu season is coming. There have been 2 confirmed cases in Connecticut already. It's a quadrivalent. The flu vaccine this year is a quadrivalent or has 4 strains as it did last year. They're administering it in our critical care marathon. They're also doing it outside of employee health on the first floor. Employee health is keeping a record of who's been vaccinated, who hasn't, etc. They will start administering kind of the way we used to do, doing the PPD with the flu shot. Our unit already did PPDs recently, so we're exempt from having to do that this year, but I think in future that's kind of how it's going to roll out. In terms of hospital-acquired infections, CAUTIs, CLABSIs, there are ways to look for it under Pulse, Departments, the Infection Control page. On the bottom, there's one called Unit-Based Dashboards, and you can kind of see how we're doing comparatively. The best prevention, obviously, for a CAUTI is just to not use one. So it is something we should bring up daily in rounds, whether patients need it or don't need it. There is, under the bundle, the fully insertion bundle, there is an option that we can remove that. So do assess, and if it's not needed, do that. We talked about CLABSI as well. In terms of lines, how to keep lines clean. Presently, we still are deferring to multis for line management, but each day when you go and you look at a pick or a central line, if the dressing's coming up, if there's blood, if it looks funny, just call multi, let them know, since that's kind of in their realm to be managing that. There's another Ebola outbreak in the Congo, so and there's a measles outbreak in the U.S. right now. So on that admission assessment chapter where it's asking if patients have traveled recently, especially outside of the U.S., just there's good reasons for asking those questions. So do that, and notifying infection control right away if there is any exposure in that way. Okay, something that I think is probably the most important thing that we talked about for documentation of isolation. I know I've been getting a ton of patients that are like, there's the task to assess or document what we're doing, whether we're maintaining isolation, continuing, initiating. So there are 3 places we have to cancel out if somebody no longer needs isolation. For instance, they had metapneumovirus when they first came in, but they've treated it, it's resolved, they don't have metapneumovirus anymore. What do we do for that droplet precaution that comes up? And, each day at the beginning of shift when you're documenting how they transport off the floor and there's, the droplet, you have to unselect it again. So 3, first of all, let me show you a patient ID band. I did not know this is what they looked like. This little asterisk is what is replacing the bullseye on the name band. If this is the name band, just that teeny little star is what used to be a bullseye. So if someone has a history of MRSA or something comes in, that's what they'll have on their wristband. So when you're looking at the wristband, obviously scanning for meds, or on your morning or first rounds when you're going and getting a report and you're checking the name band, just take a look for that asterisk, make sure we're isolating appropriately. But to cancel out the need for isolation if a patient doesn't need it, for instance, like we talked about the metapneumovirus one. So under your problem list in the interactive view on the left-hand side of the screen, if you click on the problem list, it'll say all of the patient's like medical history as well as active problems. So for the one that says metapneumovirus, then you resolve that problem, resolve acute phase, kind of like we used to do when we discharge. You can cancel that, you can discontinue that problem or resolve that problem. Under orders, there's an order for isolation, so you can discontinue the order for isolation. And then under system orders, you can discontinue the task generation. So that's the thing that is popping up the every 4-hour assessment of isolation need. And you go under system orders and you find that task and you discontinue it. That I think is most of what we talked about this morning. There are pictures if you want to see them of like the hand hygiene compliance. We're the yellow one. And there's us, 10 East, doing pretty good. All right.